Welcome to Soul Wellness with Kristen, where we get into the nitty-gritty of various holistic modalities and explore exactly how they help you heal. I'm your host, Kristen, and I invite you to join me on this enlightening expedition where we explore the connection between mind, body, and spirit. In each episode, we'll talk in depth with holistic providers, medical professionals, therapists, and healers. Our goal is to empower you with knowledge, inspire you with stories of resilience, and provide practical tools that you can integrate into your daily life. So, find a comfortable space and join us as we explore the multifaceted world of holistic wellness. Get ready to learn how to improve every aspect of your life and simply feel good. The adventure begins now. Thank you for joining us for another episode on Soul Wellness with Kristen. Today we are talking to Christiane Matey, and she owns Mint Nutrition. She is an integrative dietitian, and I am so excited to have you here because I'm a big fan of your work.
Thank you so much. I really appreciate you having me here.
So tell me and everyone else a little bit about your business.
Yeah, so I built a business based on patient-centered care. I work with many different people with gut issues, inflammation, autoimmune, weight loss, sports performance. So I've got the wide range of patient population. Really the basis of the business is really meeting people at their level. So I try to make recommendations, find out how they want to live their life and help them implement them. So I'm more like a health advocate, I guess you could say, and then really just working with people to individualize whether it's nutrition or supplements or lifestyle recommendations so that they feel better and get to their goals.
I love the fact that you take insurance, and I love the fact that as an integrative practitioner, you don't require any kind of membership fee or anything like that. People can work with you as they want to work with you, how they want to work with you. You're not locked into anything when you sign up with Christiane.
Absolutely. So the business is really set up so that you can come to me for a period of time. If you do a program, it does fast track. It gives you lots of information, tons of support. Additionally, some people don't have a money tree out back, so they're like, well, I don't, want to spend that additional money. I just want to come and pick your brain for a couple things. So it's a very open door policy. You can come and work with me for a period of time. You can continue to work with me over weeks, months, whatever it is. And with taking insurance really is a game changer because that often can be covered up to 100% unlimited. So even if someone does a program for 3 months, they can still continue to see me weekly and insurance will cover their one-on-one sessions, which is phenomenal.
That is phenomenal. Tell me a little bit about the type of testing that you do.
Yeah, so in the integrative world, as you know, there's so many great tests. You can do DNA tests and you can do GI tests. You can do all the fun things. So I try to, if I recommend testing, it's going to be more about how much information I can get for a small amount of money and not as invasive, because sometimes I get patients coming in with, they've spent $8,000 on supplements and labs and they weren't really looking in the right spot. And I just want to cry for them. I'm like, oh my gosh, they spent all this money on things that I think just don't make a lot of sense. It's not really getting to the root cause in my training, so I see that. So there's certain testing that or my go-to, like hormone testing, I think is amazing, looking at your cortisol and all of those types of things. Additionally, if someone does come with me with GI issues, I use a urine test, which is super helpful. It's called the organic acids test, and often we'll discover root cause problems, possibly mold or mycotoxin illness and candida and bacterial overgrowth, and in addition to finding out all sorts of nutrient deficiencies, which is great.
So that's what we're going to dive into today is mold, and I'm a big fan of the oats test because I actually took it with you and I was blown away. I was having a lot of fatigue, basically falling asleep every afternoon after lunch, could not hold my head up. But I've also been a migraine sufferer for 40 years. I started having migraines around age 9, 10 years old. And I don't have migraines anymore, like maybe once a month. But so any migraine sufferers out there, I want you to know I've tried everything. I have gone down every rabbit hole and I'm a lot better now. So I'm a big fan of this oats test because I can't believe what all it shows you. It's such a simple test. It's a urine test.
It is. It's complicated to read, so I think a lot of integrative practitioners don't really like using it because it is hard. It's not, I've been mentoring under someone for a few years now, and I still learn every time I have a test. I'm always learning from her. Wow, I didn't realize that, because it's looking at almost like the little crumbs that are left behind. So when you're looking at a B12 deficiency, we're looking at methylmalonic acid. When it's elevated, it means we don't have enough B12 in the body. So often I think it really paints a good picture of like, are there big items happening such as fungal overgrowth or bacterial overgrowth? And it really is insightful where, yeah, I think there's an infection, and I'm like, oh, looks like there's fungus and there's no active mold. So we can actually tell if there's mold that you're being exposed to, and that it's moving in the body and it's activated, because mold likes mold. You can have candida by itself. If there's a mold exposure, you're going to have candida.
It's so fascinating to me. But it's also fascinating as to what mold causes, the symptoms. So talk to us about some of the crazy symptoms that you see, especially like the chronic stuff that you see.
Right. So even in a house, so you have a leak in your attic, and they repaired it over time, or maybe it was leaking, you didn't know for a long period, and it's now in the house, and you'll get out of, let's say it's a family of 5, you'll have one really, really sick. You'll have one maybe mildly sick, and some of them are nothing. Like, you couldn't even tell that they've had exposure to mold. So it's fascinating. A lot of the medical history takes into play factors, whether they're genetic stuff, and we can find out on organic acids if there are genetic SNPs, just based on some of the markers. So if they don't detox well, like they're a poor methylator is what we really call them, all this stuff is starting to accumulate in the body, and then they can be really chronically sick. And it's usually my chronically sick people, they've seen 10 doctors with no answer. You're fine, there's nothing wrong with you. And they're all, coming in tears, practically like, I don't feel fine, I feel horrible. So it could be anything from like neurological to gastro to cravings, sugar, alcohol, starches, because the candida wants to be fed or the mold wants to survive. So often people will have weight loss issues, lots of inflammation, autoimmune diseases. There's a small percentage that have weight gain problems. You and I know some people, you've sent me some people too, that are just really, really thin. They can't gain weight. They look almost sickly in a sense. It's just that inflammation, how this responds to their body. So it's fascinating to see. And I've had people come in, a couple come in, and we discover there was mold in their house, and she's very immunocompromised. The husband comes in with, we do a toxin panel to find out what's in his body, and he has no symptoms whatsoever. So it was fascinating to see, wow, to be in the same household and to see on paper, you have a lot in your body, but you have no symptoms. So it tells me that he's just taking it in and he's able to get rid of it.
Right.
She's accumulating and having a really hard time just getting better and functioning on a normal level.
But you can see how that would completely throw somebody off. If they're living in a home and everybody else is well and they're not well, they're not going to associate where they're living as the problem.
No. And it's almost, I would say daily now, I'm at that crossroads where if I mention it, consultation call, because they do free consultation calls, so people will call me and then we uncover water damage. I might say if they have markers and stuff, hey, did you have any mold in your house? Or, oh yeah, we had it at work and they just remediated and I was there. And I've been sick ever since. And I'm like, it's just got settled in the body and it's creating problems. So we just need to be able to get out of it.
So when you do a consultation, I love that you offer a free consultation, because there's just no reason why somebody shouldn't call and talk to you if they're having a chronic issue.
Sure.
Do you run down a questionnaire or something like that you can go, okay, check. This person definitely needs to have this test or this test so that I know for sure?
Not until I get to the health assessment necessarily. So it's more like, how'd you hear about me? What can I help you with? Usually people aren't like, I feel great, I want to learn about anti-aging. I have a small percentage that does that. It's exciting. Right. But generally people are coming to me because they feel terrible. So it's just a matter of, talk to me about your symptoms. What do you need help with? And then I may plant some seeds, or I don't know if it's intuition or some of the symptoms that they're having. I may just throw that out there. Have you ever looked into mold exposure? 50% of buildings have water damage. So, it's just a matter of identifying it. It's often in schools or government buildings or hospitals or, some of those places and work environments where it's like, okay, well, I'm exposed to it at work. It's just work is making you sick. So it's just more of an area, just kind of plant those seeds. But generally, we don't uncover it until the health assessment or after.
But what are the main symptoms you see when somebody comes in and you know immediately, like, oh, I know exactly what I'm dealing with? Because I see and hear people coming in saying, I have seen doctor after doctor after doctor, and they're frustrated. I know who to send them to. I know you're going to sniff it out.
Yeah, I'll sniff it out. You know, if they're having like chemical sensitivities, electric sensitivities, that's definitely a sign of mycotoxin illness. Physically, sometimes I'll have white coating on their tongue. They'll say they have a lot of sugar cravings. So I'm like, oh, they got some candida. And I'm like, anytime I see signs of candida, could be hair, skin, and nail issues, vision problems, hormone issues, GI stuff, just feeling sick, inflamed, joint pain, migraine headaches, you know. So it's kind of like the rainbow. I mean, there's so many. I think that's why it doesn't get identified, and then a lot of clinicians aren't really trained in it. So I was blessed to work under a doctor or be trained under a doctor who specializes in mold, and he said once you see it you can't not see it. And then I experienced it myself, and so having that experience myself really propelled, like, how can I help other people, but intuitively how can I pick up on some of these signs and symptoms. But again, that couple, if he just walked in for a health assessment without that test, I would never have known.
Wow.
Because he's the only one that I'm like, what? I mean, he threw me completely off. I was like, wow, on paper, physically here, I would never know you had, you know, any kind of mold in your house. Because he's fine.
That's incredible. So what do you think makes people hesitate? I feel like they don't want to go down the rabbit hole, like they're scared, but why would somebody hesitate if they don't feel good? They accept that as their new norm.
Yeah, that's a really good question. I think it's about trust. You know, I like to build really good rapport. This is why I have an open door policy. I'm like, look, tell me what you need. I mean, do I think a lot of people should be on a program? Sure, especially if they're going on a protocol. Sometimes you feel bad and you need my help, but I don't want to make that decision for somebody else. So I think maybe it's past experience. They see dollar signs. I just had someone go, I don't even want to look into mold because it's going to cost me so much money, or I'm going to have to burn my house down. I'm like, you don't have to burn your house down, but certainly you want to make sure the world's kind of a dirty place in a sense. We just want to make sure that we can get our bodies supported so that if we're exposed to stuff, it comes in and comes out, like that gentleman that I had and I do see that can help. But I think it's fear maybe, or unsure. I mean, thanks to you and a lot of my previous patients or people I see now, I have a huge, you know, following, or people that are constantly coming to me because they've got a friend or someone that's came in and they're starting to feel better. So they're like my billboards. But I think just coming off the streets, it's kind of like, that doesn't sound right. And my husband didn't believe me when we had mold in the car because he's thinking dollar signs, like, how are we going to get rid of this? It was literally in my HVAC system, in the air conditioning unit. And it's interesting, now I see signs of candida in my daughter, and I have to treat her for that because it has now settled in her. Just that period of time, which is fascinating.
It really is. It's just, you know, I think about how good I feel now, and I'll admit the treatment, it was months long. It was a slow process to get rid of it because it was a slow process to build up in my body, right? So it's not like it's just going to go away overnight. It took a few months of supplementation to get rid of it, and the die-off wasn't fun. I had a lot of headaches and a lot of fatigue during that. Those were my two main symptoms anyway. But now I'm on the other side of that bridge,
right?
And I can't thank you enough.
No,
because
you're living your best life. That's how you should be.
Headaches are debilitating, and falling asleep every afternoon is not productive.
No, and I always tell my people, I'm like, please knock on my door and tell me you're living your best life, because that to me is like giving me $1 million. Because I don't think we should walk around feeling horrible. I do think people are very unaware about how bad they're feeling.
Agreed.
Your brain is like, I can handle all of this, but your body's screaming to you like, pay attention. I'm falling apart. You know, and usually nothing happens until a diagnosis comes into play, because let's be honest, this stuff can get kind of yucky. I mean, most of my people, it's not, you know, catastrophic diagnoses and stuff, but I have a few handful of people, it did change their brain. It does change the development of the brain. It can settle in the body and have growths and stuff. So not to freak people out, but it's not something you really want to ignore, and it doesn't get resolved on its own. I think it's back to your question just a minute ago. I do think it's fear derivative, because they see dollar signs, or I'm not sure, you know, how to tackle that. So that's where I do see myself as a health advocate. I'm like, look, just gather as much information. Don't make any decisions. Like, find out what's most meaningful to you. Because even if I do discover that there's mold from an oats test in someone's body, many times they don't look into it. They don't want to.
And the thing is, you have markers in that oats test that tell you whether or not the person is being continually exposed to mold, or if it was an exposure maybe, I don't know, a while back. That's great information.
Right. In beyond that, we see really on a cellular level how that affects everything in the system. So I was trying to explain to someone going over their test result is that it's almost like a vortex, like a black hole. It starts to rob your body of other nutrients because these toxins either these infections prevent you from getting all the nutrition or nutrients that you need to function. And there is a process that has to happen in every cell, otherwise it dies. That process has to happen, no different than you breathing or pumping your heart. But on a cellular level, we're able to see through that test to see where are you deficient in. I can see some of the signs and symptoms, like whether you have your proteins you're not absorbing enough. And then we start to see that toxin or the toxins start to chew away and utilize some of those other nutrients, B vitamins, magnesium. And then there's deficiencies in there. And this is why on a cellular level, it's fascinating to see how it starts to rob all of that. And you're like, wow, that makes a lot of sense. It only really solidifies too some of the things that I recommend. I'm like, well, you're already on a methylated vitamin, so it will help replenish those things that are there. Additionally, I always say food first, supplement second. Then we can add certain foods like sulfur-rich foods. We can see a lot of toxicity in someone's body, and we're like, go eat eggs and onions and garlic and some of the sulfur-rich foods. It helps you detox naturally. And so I think those are things that people go, oh, that's something I can do. It's not, I've got to buy another $500 worth of something. I'm trying to, educate them. So it's like, you should put this in your diet regularly so your body can do this naturally on its own.
Yes, exactly. That's what I found fascinating with the oats test too. I take a handful of supplements every morning and always have. Yeah. And your results, those results you gave me on the oats test, you were like, you are so deficient in all your vitamin Bs, your amino acids. It's why I was so tired all the time.
Yeah.
I was not absorbing anything that I was taking.
It's amazing.
Just getting robbed.
Yeah, getting robbed. And their food, it doesn't have the best soil either. So it's probably not having a good basis in the certain foods. Even if you do eat a robust amount of foods, now are you digesting it? So I'm always looking at biomechanics. Do you need digestive enzymes? Because we should start there. If you're not breaking down the food, then it's going into the small intestine, undigested, causing more problems, and now we have deficiencies. So,
and that's another point, because back in my pharmaceutical days, I sold a proton pump inhibitor, and now I have learned from you that after a certain age, you are deficient in stomach acid. That's what's causing your reflux. That's what's causing all your digestive issues, not the fact that you have too much acid. It's because you don't have enough.
Right. Yes.
I love all the things that I have learned from you.
Oh, thank you.
You're a plethora of information.
Thank you. And I keep I keep a bottle. So when someone comes and I see that, because now I'm studying iridology, so I can see in even their iris if they don't make enough stomach acid, and then on their nails. So there's little physical signs, and I go, oh yeah, they need digestive support. And I'll give them a little packet of the digestive enzymes. Go try these, and then I'll give them, okay, here's the instructions. And 99.9% of the time, they're like, that worked great. Help with less bloating, and motility is getting better. And usually people don't say, oh my gosh, I feel so much better taking them. They may notice they're less bloated, but usually it's on the cellular level. I want to make sure those nutrients are going to get into the cells versus just floating around.
Right.
Or being robbed from somewhere else.
It's amazing. You also guided me on taking better supplements too. So it's all good. It's all good.
Yeah.
And I feel so much better.
That's exciting. And you look amazing.
Well, thanks.
You're so welcome. You did all the work. I just am the catalyst.
Well, it was a process. Like I said, it's not something that's going to happen overnight. You didn't get into the position you're in feeling bad overnight, and it's going to take some time to clean all that mess out.
Yeah, and your body, I think that's probably one of the most common questions of people, like, how long is it going to take? And I'm like, I don't know. Your body is complex. Conventional medicine puts you in a box. Integrative medicine's like, look, we do not fit in boxes, and especially when you're dealing with gut biome and infections, and how long has it been happening? Do you still have are you still getting exposed to stuff? It's just, it's one of those things that I don't know. You could be better in a few months. You could be just coming and going. That's why I keep that open door policy. I'm like, just come and see me when you need to, and we can always retest and see where you're at if you're feeling off, and then what do we need to adjust that to keep the momentum going. That's
a good point, to be able to retest, because the oats test is not that expensive. We're not talking thousands of dollars. It's under $300.
It's $300.
About $300.
Yeah, it's about $300.
Okay.
Yeah. So I keep it pretty simple. It's a urine test. It's easy.
It is easy.
Yeah. It's nothing beyond, and you'll find out even about neurotransmitters. I didn't even talk about that. Your norepinephrine, and dopamine, and serotonin in the brain, neurotransmitters. So we can pick up on a lot of stuff there.
So is that giving you insight into that person's anxiety and depression levels and all of those things?
And where they're needing more support? Sometimes we can see. I haven't gotten there yet because I'm still sort of training. But when I do these tests, I actually consult with a clinician who reviews it with me for about a half an hour. We go line by line, which is amazing. So I give them, here's a snapshot, here's their history. So in my mind, I'm always like, look, the more the merrier, the better outcome we're going to have on the patient. So they're going to get there better, faster. So sometimes she'll look at something and she helps connect the dots of, I had a patient who she had arsenic poisoning. We don't even know how or why. I said, that's really interesting. Sure enough, we did the organic acids test. I'm like, ooh, you got some active mold, and it was in her house and she didn't know. But the clinician picked up on having gallbladder support, and so we did give her some gallbladder support, and it dumped everything out. And then she was able to detox a lot better, but I think her gallbladder was stuck. And I was like, I don't know how. It's amazing how they pick up on a urine test that your gallbladder needs support.
That's incredible, because if she hadn't done that,
she would have been horrible going through the protocol. She would have had really bad symptoms, because your gallbladder, your body wants to purge and detox. And if there's something that's blocking that, whether it's your kidneys or your gallbladder or your liver's not working, supported properly, or heck, your methylation, how you're pushing detox with certain genetic SNPs, it starts to block it, and then we start to accumulate, and then people are not feeling good at all. They feel terrible. So it's the die-off symptoms will just stay in the body, because the die-off symptoms are basically you're killing off fungus or bacteria or some of the bad bugs, and they throw off all these toxins. They start accumulating in the body. So if you're not able to go to the bathroom, your kidneys aren't functioning normally, you're not able to push those detox pathways, you're just recycling them in your body, and you feel bad. So we have to move the bowels, we've got to get things out, and things supported so that you're not feeling as bad. So that's where, some people do need to see me quite often, because we're trying to make sure you're not feeling horrible. But if those pathways aren't supported, then yeah, you're going to feel pretty bad.
You're going to feel bad, but then it makes me also wonder, in a few years, are you going to have a disease? Are you going to be having something really serious going on where you're having to have your gallbladder taken out or something like that?
Absolutely, because it makes you wonder, why is it sludgy? Why is it blocked? And so if you can get the things to help support that, to push it out, then absolutely, then things are functioning normally. It's no different than you get a stomach bug or a virus. Your body's like, get rid of it. It's like, that's why you don't you don't want to go on Imodium and block that. You want it to get it out of your body. So your body's meant to find balance. And so if it's not, then it starts to get dysfunctioned in many ways. So I'm always looking at the different types of pathways, sweating, that sort of thing, to make sure, okay, we're able to get these things moving. And I'm always like, look, make sure your bowels are moving, because nothing worse. I just had a call with someone earlier, and she's a clinician, she's, a doctor, and she was like, I had no idea. And I said, well, yeah, I mean, if you're not going to the bathroom, you're recycling hormones, you're recycling toxins, you're recycling bad cholesterol. So we'll see high cholesterol levels. So when you're not going to the bathroom, you feel terrible. Like by day 2 or 3, you're wanting to punch someone in the face because you feel toxic. So think about it. If you're trying to get rid of stuff and it's sitting in that large intestine or wherever stuck, you're just recycling all the bad stuff. So moving the bowels is huge for all sorts of things. People don't realize how much the bowels are associated with hormones too. They don't realize that.
Well, I love the fact that doctors actually come to see you, because you're changing how they practice medicine. You're changing, when they see a patient, they're trained all, Western medicine, God love them. They're trained.
Yeah.
They hear a symptom, here's your prescription, see ya, on to the next.
Yep.
But now you're creating that awareness, and you're going to make them think.
Mm-hmm.
They're seeing these symptoms and they're like, wait a second.
Right.
Before I write you this prescription.
Yeah.
I think I know what the root cause is now.
Right. Or I'll send you someone who will find it, because they're usually not trained to see you more than 15 minutes.
Right.
Like, let me write it and off you go, or let me just refer you to a specialist.
Right.
So,
right.
And that's the beauty of integrative medicine, is that it connects the body, so all the organ systems are connected. That's why I'm able to see a lot more. I'm not a doctor, but they trained me and treated me as if I was another doctor, so I know all the protocols, and I have great clinicians I can flip people to and say, hey, I need this for my patient. They need hormone support, or I need the specific medications because they have MS. It'll help stop the progression of MS, and that's not known in convention, which is amazing.
It's just fascinating. I feel like it's an open road for you.
Yeah, thank you. Yeah, and more clinicians are heading that
everyone.
way. Yes, yeah, oh, for sure. And then when it's not my wheelhouse, or it's the right, I'm not for everyone, of course. So I feel like if we got to tag someone else first, some of the extreme Lyme disease cases and stuff, I'm like, we need to get a team of people, or some of the mold that is causing seizures or something like that, then we need to have more of a team approach. But anytime I welcome that, team approach, because I think if I can help tag their clinician, hopefully they're a little bit more open to the integrative side, not always. But when they are, it's great. Then we can all tag team, and it's a better outcome for the patient.
Absolutely. Absolutely. I want to talk about too, I know people get intimidated with testing their homes for mold, or their businesses, or their cars, or whatever. I personally went through that process. I know you have too. It's not as bad of a situation as you think. Some companies are a little bit expensive, but you can do some mold testing on your own as well. You can buy kits at Lowe's, which is what I did first. Went and bought some Petri dishes, sat them around the places in my home that I hang out the most, and a couple of them lit up.
Right.
And I thought, all right, I got to call in a specialist. And I had them come in, and yes, it was a few $100s. But it was in my HVAC system. And the mold company that came in and rectified that said, oh, we see this all the time. Okay, we're in the South, yes.
Yeah.
But I had no idea that mold is that prevalent in an HVAC system, because I'm thinking in my head, this is airflow, air moving. How can something be wet and damp and grow in an HVAC system? Well, the mold guy explained that to me as to why.
Sure, absolutely.
And it's an easy fix. They clean it out. They do some antimicrobial action. It's done.
Yep, done, dusted. You don't have to burn your place down.
No, you don't have to burn your place down. I took my carpet out as well, just for extra measure.
Yeah, which I think is smart, because it does get in upholstery and you can't get it out.
Yeah.
A lot of people use bleach, so bathrooms are a great place for mold, in the showers and everything else. And I'll always teach people, just get a big old jug of white vinegar, distilled white vinegar, a big bag of baking soda, and scrub away. It doesn't like either one of those. So.
Yes, vinegar. Vinegar is a substance I don't think I can live without. I use vinegar. I think every.
Put it in your laundry.
I use it every single day.
Yeah. It's amazing, isn't it?
It really is.
Yeah.
All right.
Yeah. So testing. I always recommend making sure that whoever tests never remediates. It's a conflict of interest, because it's hard for you to trust someone who's like, oh yeah, we'll test for it and we'll take care of it, and then we'll retest again. And
agreed.
I think it's not a good practice, in my opinion. So I'm always pointing people to, was it moldtestcompany.com? I think that.
The people that I used were out of Statesville.
They were out of Statesville.
Yeah, which I gave you their information. They were wonderful.
They were great. Yeah.
Super easy to work with. They do not test, and they say the same thing. We're not testing that as a conflict. We treat. Period.
Yeah. Absolutely. So it's something you don't really want to ignore. You can poke around. It does leave wet stains you'll see, or bowing walls. I had someone. I have a lot of people on the coast of the lake, many mold, and it's usually just a damp environment, so it can be in the HVAC system or a leak. And I think there's if there was a leak and it wasn't fixed, I would be poking around. And then you want to be I just say you want to be a dork about it. Put a whole hazmat suit, goggles, mask, because Once you disrupt this, it becomes airborne, and you can absorb it through your skin, your eyes. You can breathe it in, and now it'll settle in your lungs. You can get things called fungal balls, which is terrible in the lungs.
Wow.
I have a patient who has one of those. In one of her lungs, they did a CT scan and found lesions. They weren't sure if it was cancerous or not, and she has mold exposure. So I said it's probably aspergillosis, I think it's called, or aspergillitis. It's fungal balls is what it's called. Yeah, no fun.
Well, I want to roll back to where we were talking about once your body is doing what it's supposed to be doing and detoxing properly, and you've got these little bugs and things cleared out, then you're able to handle your exposures and not get bogged down and start going down that rabbit hole of getting sick. Because we live in the South and we are surrounded by mold, and mold is part of our ecosystem. You can't get away from it.
No.
So it's not something to be completely freaked out about, but you don't want to be living with something toxic in your home or your workplace.
Yeah, or your children. You don't want your kids to be around that too. Air purifiers are good. There's all sorts of stuff that's super helpful. If you find it and the company's going to come out and remediate it, don't be there, please. Like, change your air filters. I think it wouldn't be wise to be in the same space when they're breaking it all down or pulling it apart.
Yeah, exactly.
And if there's mushrooms growing out of your living room floor, someone showed me a picture of that, and I was like, oh my gosh. And they had a little one in that house. I was like, oh my gosh, like that. Oh, she's like, my husband will take care of all of it. And I was like, I would highly not recommend. If he does, he needs to be in like E.T. hazmat suit. With the lights in the veil, everything, like as if you're going to Ebola. Like, don't.
Oh my gosh.
Yeah, and then it'll get into your clothing and all of that. So yeah, throw some white vinegar in your laundry. I was going to say, vinegar to the rescue. Yep, throw vinegar in your laundry. At least clean out the laundry machine's another one too, especially those front loaders. They get really moldy and musty smelling. They start smelling musty, or you see mold, run some vinegar and baking soda through there.
Yeah. Awesome. Well, this has been super fun. I'm going to have you on again because I can talk to you for days.
Yeah, we can talk all day long. Talk.
But I want you to tell people how to find you, social media, website, everything. How do they find you, and what's the first step to working with you?
Sure. Yeah, they can pop on to themintnutrition.com. We are on Instagram, Facebook, for the most part, so they can go on to either one of those, but the website's probably the best, and they can schedule and book right there, or they can send in an inquiry to do a free consultation call, and then after that we have them find out what their insurance covers, so that they're really clear on, like, here's what my out-of-pocket expense. It is a hybrid model, so insurance will only cover 101. It doesn't cover any written plans or programs or anything like that, but we disclose to our best knowledge, and obviously finding out what insurance covers makes a big difference.
Okay, perfect. So that was www.themintnutrition.com.
Yeah.
Perfect.
Yay.
Thank you so much for being with me today.
You're so welcome. Thanks for having me.
Awesome. I will be talking to you again soon on this podcast.
Okay, sounds great. Thank you.
Thank you for joining us on another enriching episode of Soul Wellness with Kristen. We hope the insights shared today have resonated with you, inspiring a deeper connection to your own journey towards holistic well-being. If you enjoyed today's episode, we invite you to subscribe, share, and reach out. Your feedback fuels our mission to bring you meaningful content that educates, empowers, and uplifts. Remember, you are a vital part of this community, and together we're creating a ripple effect of positive change.